The first question is hypothyroidism an autoimmune disorder? There are many reasons that cells in the thyroid can't produce enough thyroid hormone, and autoimmune disorder is probably going to be your most common reason. Autoimmune thyroiditis can develop over months, and sometimes it can take years for it to present. The most common cause of this is Hashimoto's thyroiditis. Now, other reasons to have hypothyroidism include surgical removal of the gland, radiation treatments in particular to the head and neck, congenital causes, medications, damages to the pituitary gland, and even very rarely infiltrating diseases into the thyroid itself, such as hemochromatosis. The next question is there a link between Hashimoto's and glaucoma? There's an article that's published from 2008 in the British Journal of Ophthalmology that said that there might be a genetic link between hypothyroidism and glaucoma. Simply said, we really don't have enough research creating a true genetic link, so I do think we need more research in this to determine the causative effect, but it does appear to be that there is some kind of link there. I do recommend that any of my patients with thyroid disease get routine thyroid eye screening as part of their workup, just to make sure something's not missed, because there can be subtle findings with hypothyroidism as well as hyperthyroidism. Can we get vaccinated for COVID while also having Hashimoto's? The answer is absolutely. People with Hashimoto's can receive the COVID-19 vaccine. There's been no specific data for patients with Hashimoto's, but both vaccines, Moderna and Pfizer, included people with autoimmune disease, and neither of these showed autoimmune flare-ups as a result of the vaccination. Why do many endocrinologists not believe in prescribing T3 medication? I wouldn't necessarily say this is true. I think the main thing is looking at the individualized patient, their labs, and their symptoms. I wish it was a cure-all for all patients that started to take T3 and felt significantly better, but it really honestly is not appropriate for everyone. People that convert over just fine actually may have some hyperthyroid type symptoms if they start it preemptively. The most important thing is honestly finding a provider that you feel comfortable talking to about this and seeing what your concerns are, as well as someone that's willing to discuss your results with you. Again, thyroid care is very individualized, and it's important feeling out the provider and finding a good fit for you. What is the difference between TPO and thyroglobulin antibodies, and which diagnose Hashimoto's? Well, TPO antibodies is how we diagnose Hashimoto's. A test for an anti-TPO antibody may be useful in helping to predict the likelihood of progression to hypothyroidism in a patient that may otherwise have borderline lab results or normal lab results. Thyroglobulin is specifically made by follicular cells in the thyroid, and it's secreted into the thyroid follicle. Now, patients with Hashimoto's or Graves' disease may have positive thyroglobulin antibodies, but it's not needed to measure to see if someone has autoimmune thyroid disease, since it's quite nonspecific. What tests should you have done to determine why TPO antibodies are too high? Well, TPO antibodies are an inflammatory marker, so they're a constantly moving target, but they're how we determine if someone has Hashimoto's or not. We use it as a tool to predict if someone's going to develop hypothyroidism in the future, if someone has the autoimmune cause of thyroid dysfunction, but it doesn't truly guide treatment other than give us that bit of information. Now, how we guide treatment is based on a TSH, a free T4, and a T3. And based on that, we determine what your dosing is appropriate. Some of this is based on symptoms, but some of this is also based on lab results as well. How often should you track your numbers? Well, the answer to this is a little bit mixed. It takes about 6 to 8 weeks for us to start seeing a difference in lab results. So anytime after the 6 to 8 week period is an appropriate time to check. Now, once your levels are stable, usually we can back down on how often the frequency is based upon how stable you've been. If you've been on the same dose for years, probably checking in once or twice a year is good enough, or of course, if there's change in your symptoms. Otherwise, in the initial evaluation, we are checking you more often. Now, checking more frequently than 6 to 8 weeks is probably not helpful because we won't see the true reflection in the lab results, not meaning that you're not going to feel better sooner than that, but we just won't see it reflected in the labs. The final question is there a connection between Hashimoto's and chemical sensitivities like cleaning products, bleach, and skincare? There are many endocrine disruptors that we can find within chemicals that we use on a daily basis. The National Institute of Environmental Health has created a list of what they believe can be found in detergents, foods, toys, cosmetics, and pesticides that absolutely affect our endocrine system. Chronic usage of these products has been shown to increase chances of obesity, diabetes, endometriosis, and even some cancers. Now, part of the problem with the thyroid is that they can mimic the thyroid hormone itself and sometimes bind more firmly, so inherently will cause a disruption in the natural process between our pituitary gland and our thyroid. Now, here are some strategies that you can use to kind of forego some of these effects. Replacing personal products with natural or homemade varieties can be done. There is the detox market that has some more information on this. You can try and buy as much food and beverage that contains BPA-free packaging. Trying to purchase organic foods as often as you can. And finally, trying to buy more natural cleaning products because we do use this on a daily basis, and ultimately this affects everything that we're touching on a constant basis.